Okay, so good afternoon. So we will be talking about the ethics on innovation of uh, education in healthcare system. So ethics. So actually, when we talk about ethics in education and rehabilitations, we have a lot of uh, topics about this. Before ethics and rehabilitations, especially in physiotherapy, it is just or physical therapy, it is just incorporated in one of the subjects. Basically, in administration and management, or O&M, or organization and management. So it is where the ethics is being integrated, especially the discussion. Now let's discover here this afternoon uh, when it is should be integrated in the curriculum. Now, when it comes to education. So we'll discuss that this afternoon. So ethics. So when we talk of ethics, uh, from few decades, the role of rehabilitation professional has evolved, shifting from allied health professionals under the direction of physicians to increasingly autonomous practitioners with independence and accountability for making clinical decision making. That is according to Swisher 2002. So at the start, um, physical therapists are under the physicians. It means that whatever they are going to do in the clinics, it should be supervised or it must be known by the physicians because they are directly under the physicians. But as the years progress, the profession evolved as well as the type of education that is being received or being introduced in the academy also changes. Now it becomes more uh, since the clinical settings evolve. So what happens now in the clinical settings, the rehabilitation professionals, which physical therapists are included, undergoes slowly into autonomy. So therefore, the ethical approach in the academy or the introduction of ethics in the academy should also change because the rehabilitation professionals now are not under the doctor, but rather they have now a different type of relationships. So therefore, the ethical approach or the ethics discussion in the academy should also change in order to cater the changing clinical setting in the rehab. So, ethical decisions making and moral virtues are dimension of clinical expertise rather than separate steps in the process of providing uh, physical therapy. So, it means to say that ethical decision making, your moral virtues, these are not separate. No, these are lumped into one dimensions in which okay, it is considered as clinical expertise. How can you make how can you make a clinical decision makings that will not create friction with other professionals, that will not create barriers in the other professionals, that will build good relationships with them. Okay, so that requires expertise in that aspects. ethics is very or plays ethics as well as moral virtues plays a very very important role. Okay, this is reflected in changes in terminology. So if you notice before, we in the in the clinics or even in the academy, we use the word patients, but now we consider now patients as our client. So then it turns out to be consumer because yes, basically your patients now are your consumer because they are the one consuming your product. Your product is your expertise. So when you talk of consumers in 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 economics, when we talk of consumers, consumers has a very or has a power to command to the producers. Okay, because uh, remember in the motto of economics that consumer is customers is always right and consumers is your customers. So it means to say they have the power to change the 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 status of these ethical standards in the clinics or in even in the academy, no? Because again because consumers plays a very important role, no? So here they have no power. Okay, so number one, because in order for you to practice, you must take the consent of your patients. If the patient will not give consent, then you cannot perform your clinical expertise, your treatment procedure to your patients. So, consent, giving consent to you is one of the power of your consumer. Okay, of course, there are a lot also. Now, there are other powers, the right of data privacy, confidentiality. These are powers in it given to the consumer. As a physical therapist, you must respect this power, okay? Or you must show respect to this power. In showing respect to this power of the consumer shows an clinical expertise which involves ethical decision or clinical decision making. So, while health practitioners have more autonomy and patients may be more knowledgeable participants, there has also been an increase in team decision making, with members seeking to reach consensus before proceeding with decisions. So, so as the power of the consumers or the patient increases, as well as the knowledge of the uh, as well as the autonomy of the rehabilitation practitioners become more autonomy and the knowledge of the patients or the consumers increases, the team decision making also must seek consensus before proceeding as the team also member of the rehabilitation group increases. So before they could make a final decisions referring to the demand of the consumers, they have they must first come up to consensus so that they will have a one decision. Of course, basically, that decision should be patient centered. That is based on ethics. So, ethics in education and professional programs. So, now this ethics class is introduced in the curriculum. No? It is introduced in the curriculum by means of educators. So, educators considered incorporating broad-based approach to the study of ethical theories and moral decision making into their curriculum content. Okay, so the most frequent themes for the content where ethics related to are the following: research, professional issues, and clinical experience. So these are the basic theme of ethics in the curriculum. First, research. Research means, uh, of course, confidentiality of your respondent. Second, uh, in using only the journals, it must require citation. You must cite the author of the journals, uh, properly cite them, acknowledging their work, and not copying their word by word for word statement in your research, but rather paraphrasing them. But of course, you can copy, but as long as you must cite it properly. Okay, so that is an example in research. And second, in professional issues between PT, interprofessional and intraprofessional. So you cannot just simply barge into someone and say, "Ah, you're doing it wrong." No, so you must observe uh, ethical way on how to approach this professional also. And clinical experience. How do we relate to our client or to our consumer when it comes to clinics? Especially when important decisions should be made by the consumer. Okay? So these are the common topics that usually introduced in the education when we talk of ethics. Okay. So survey says uh, that occupational therapy and physiotherapy programs provided ethics education. The issues of moral reasoning was much less clear. So before, the issues of moral, uh, the issue of moral reasonings is not yet uh, really discussed in the academy. So let's take for example, a captain of the ship jury. So these are the basic, no, sa pag siya. So the discussion there with regards to that, especially in organization and management, it is not very clear. Now, ethics is touched there, but in a very slight manner, no? Especially during our time when we talk of organization and management. Tapaw lang kung sa Bisaya pa ang pagka-discuss aning ethics, no? Sa amo nga time. Unlike now that we have really ethics. Uh, do you have how many ethics subject in the curriculum that is introduced? I think there are two. But not only that, you have still cultural competency in your first year, which also discuss about moral awareness, cultural sensitivity, which is part of ethics. Okay, so moral reasoning was defined as this philosophical inquiry about norms and values, about ideas of right and wrong, good or bad, what should or should not be done, what ought to be done, how you make moral decisions in your professional work. So here we talk of morality, what is right and wrong, not only in one aspect of the of being professional, but in all aspects. So while more traditional formats as lectures had been main means of providing ethics education, evidence supports that the use of small group case-based learning that is clinically relevant and that promotes group discussion and ethical decision making. So that's why it for us physical therapy in our physical therapy department we are so fortunate that there are only a few of you because we don't have to spend our discussion in a big group wherein it is very difficult to transcend the importance of ethics in the academy as well as in clinics, no? So here it is emphasized that it should be in a small group. So as you can see now, so from the start, from first year, second year, third year, you can easily identify ethics is being applied in 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 this level in different ways. No? In first year, you have your assessment. There, it is being emphasized how to properly ask questions with your with your client or with your patient or with your consumer. And there also you are uh, it is being introduced to you the proper care on how to properly drape your patients. So in every level, the discussion of ethics or the integration of ethics in the in the education or in the academy is being presented in the class in different way, no? Depending on the subjects where it is being taught. Okay, it is not only being taught in ethics courses, but as well as in other courses, it is being integrated. Okay, so it is integrated in the curricula. Now, traditional educational models that are built around subject-driven courses, problem-based learning provides an integrated curriculum that is driven by the content of healthcare problems include each term of study. There is substantial interdependence between terms among faculty. Even a small change in the content of problem may alter the learning that students identify and pursue. So here, it is being emphasized that uh, in, in traditional or subject-driven courses, uh, usually what is in the content or in the coverage, it is the one being discussed. But now in problem-based learning, everything now, especially in outcome-based, as we all know that OBE is a broader type of curriculum where PBL is only one aspect of OBE. So here, it is being emphasized that using your outcome-based education, so you need to develop every aspect, no? Not only in PBL, but as well as self-directed learning. Their class, uh, by altering this, it alters also now the type of learning where the students identified to pursue. They are now more directed to outcomes. Since that is the main purpose of PBL or OBE, in which the student must understand and able to apply these things that what is being discussed in the classroom. Sometimes we will notice that the content of the lesson some of it are being skipped by the faculty because they saw that these subjects are already redundant with other subjects and they can be covered up with there, no? Since nag-overlap siya. So, ganang uban nga content dito yan di na nakaya ni i-touch. Okay. So, diri na lang siya focus siya. So, now the learning of the students nga iyang i-pursue is mo change na about ani nga subject. So, it becomes now a more focused and more uh, ano, specific. Okay? So, the program approach the development of ethics streams across their curriculum differently based on three factors. So, the approach of uh, ethics streams in the curriculum of rehabilitation uh, educations uh, are being emphasized in the curriculum in different way. So they are not the same with other rehabilitation courses, such as in speech therapy, in occupational therapy. But let's focus this between the PT and occupational therapy, since these two courses are um, was created simultaneously, especially based on Republic 5680, no? Diba? Kani sila dungan man the creations of PTOT law in the Philippines, PTOT in the Philippines, no? They are there bounded in that law or Republic Act. So here, as you can notice, so student choice of healthcare problems. So for PT, usually the problem is being introduced in a more prescribed manner, which means it is already there. The problem is being presented. Now it is for the PT to attack it, to how to attack it, how to identify that problem, and then what approaches or what solution is he offering. So there that the students will make decisions now on how to solve this problem now. So the problem is already there. So that is the usual process of uh, presenting ethics in the physical therapy or physiotherapy. Reasoning style. So ethical reasoning style of physiotherapy that is presented in the curriculum, it is more on diagnostic and procedural method. What is the right way? This is what we're going to do. No, this is a violating the core values of sa PT. No, it violates professional responsibility. So we diagnose first what's the problem, then what is the right procedure? This is what we're going to do, and we are going to report this first to our one. Step by step, there's a procedure that is being presented. No? So that's how our ethical reasoning style works in PT. And now in OT is different way. No, it is a little bit broader. No, then according to uh, Myers-Briggs type indicator, personality of physiotherapy students are more to be judgers. Judgmental ang mga PT kano, preferring structure and organization. So, inana, mga judgmental gito nga PT. So, inana, no? Ang pag-design, let's take for diagnostic, procedural, these process are usually done by being a judge. So, unang ang outcome niya is itang judgmental. So that's why judgment plays a very important role, no? Clinical decision making plays a very important role as a physical therapist. So we must make decisions which are based on the facts presented in the what are the facts presented in the problems, no? Present in the problem. So let's not rely on uh, hearsays or in impressions or in gut. Kanang ato naman kwan gyud ni siya siguro no dili. We base it on what we saw in our assessment, no? In our special test. So inana the documents. So inana, so it must be that because we are judges, and judges base their decisions on the evidence presented. So ethics in education and physiotherapy program. So here makita ta, no? Dira ang uh, faculty. Faculty plays a very important role in integrating ethics or introducing ethics in the students. Without the faculty, uh, it is very difficult to uh, for to students to uh, catch or to make right uh, clinical decision making, because it is the faculty consensus, or yes, the faculty, the one guiding the students on first how to make decisions uh, in their practice, no? So sila magud ang naga-guide sa hunahuna sa bata or sa estudyante para makahimo og insakto nga desisyon sa ilang kinabuhi as a student of physical therapy. No? So mo na nga ang role sa faculty importante kayo labi na sa education. So these are the ethical issues relevant to physical therapy practice. So when you are already practicing, so these are the important clinical issues. First, informed consent, the right of a capable person to choose what will happen to his or her mind. So these issues is presented now even in your first, when you are still in the first year curriculum, di ba? Kabantay mo sa subject ninyo sa introduction to PT or sa inyohang dira sa inyohang PT Eval 1, no, na gina dira gina emphasize ang informed consent, no. uh, Truth telling also, so these are issues kinakwana na siya kay in subjects, no, inyo na siya in your professional subjects, it is being introduced now, no. Privacy and confidentiality, quality of life, uh, allocation of scarce resources. So it is there being slowly introduced to you. If you notice now, the term 4, 6, these are the levels where these uh, issues are being presented. Means as you go higher from first year, second year, third year, fourth year, the level of issues that is being presented so to you is a little bit also difficult, no? The degree of difficulty starts to increase. No? Sa una-una, sa yun lang, informed consent lang. Ang importante sa informed consent, sa pag-interview sa patient nimo, nga motugan siya sa tinuod, data privacy, no? Then, sa pagina siya, quality of life. So, dira, no? So, na-present na siya dira sugod-sugod. So if you notice, allocation of scarce resources, this requires more higher degree of decision making in which you are now there and the level where you are going to make decisions how to decide, no, you are already almost practicing now in the clinics, no. So basically ang subject ninyo dira unsa naman na mo sa CBR, no, wherein wala mo yung resources ni unsaon ninyo pagkuan sa patient, no, sa time ninyo, this time is a resources, unsaon nimo pag-divide sa time nga makaadto mo sa community, makatreat mo sa inyong patient, uh, kung naa mo sa rehab unsaon ninyo pag divide sa inyong time nga ma-treat ninyong patient karon, din pagkuman magklase pagid mo sa kana nga subject, mag-discuss pagid mo. So I mean, the responsibility, at the same time, the degree of difficulty of making decisions starts to increase. Professional collegiality, respect, fidelity, and respect for your professions and other healthcare professionals. So here it is now being introduced. No? Mag-create kag relationship, mag-build kag relationship sa other healthcare professionals and nurses. So you start now to go into uh, clinical educations, di ba? Ano, sa clinic, societal well-being, no? So dira ginatuluan na mo ani, no? Di ba? So natay mga subjects, no, nga naga-discuss inani, di ba? Um, sa atong curriculum. Okay, so respect of individual differences. So these are the issues that needs to be tackled. Experimental treatment. So here it is more difficult now because you have to decide now that your client is inani parts sa kwan. So basically, this is already in the upper level, which is already your internship program, organ transplantation donation. So it involves now uh, very difficult decisions. No? So not only in internship but also in actual practice na. No? So, kung na mo sa clinic. End of life decisions. Uh, Here, yan sa man, padayon ninyo yung treatment, not only in dying, no? Dira, gi-emphasize lang na kung kamatayon sa man. Kung kamatayon no yung imong pasyente, padayon ba ni imong PT o dili? Oh, so, usually, you become a professional now, that decisions will come to you, no? Or situation will come to you and you will must make decisions. Let's take for example, your patient now, wala na, plato na yun siya, no? So, unsa man, padayon pa na ako ang pag-treat, mabayad raman siya gyapon, o unsa man akong paano ni, adlaw-adlaw pa na ako gyapon siya i-treat, or I'll make na lang kay maintenance phase na lang na ako ni siya, o once, twice a month na lang na ako siya bisitahan, tagaan na lang ako siya home instruction program. Anyway, so that will come to you now. But of course, your moral virtues plays a very important role in this one. So I'm talking about ethics. I'm not talking about the course, the innovations. So this this aspect of ethics now is being discussed in your different level in your curriculum. Okay, so that's how innovative our rehabilitation or education and the rehabilitation uh, uh, professions. Inana siya. Sa una, before, kani siya nga mga areas, wala ni siya gina-discuss. No? Kay, dito lang siya ga-focus sa, because the head is the doctor. So we are not really concerned about our relationship with other professions. Kay ato raman yun, treat ra nato ni siya, kay may order sa doktor, pagkahuman, kung si problema, i-refer na to sa tong head. Kaya siya may captain of the ship that his or her responsibility to relate with others. Iyan ang obligasyon. Kung siya matabo sa pasyente, tulubago na niya. But now, as of this time that our autonomy starts to increase, our responsibility as well as our ethical decision making also becomes more higher and higher. So inana dili na ta pwede nga mo salig lang sa kana siya, no? Ang responsibility nato mo dako. Therefore, ang ato pod nga pag-decide mahitungod anang pasyente mo dako sa. So inana siya. Enter professional physiotherapy physician. So here, kung mag-treat sa patient, inana, no, our decisions will come. No? It is divided into four aspects. We talk about moral. When you say moral, that is right, and it is legal. Okay? Una po siya ay illegal and immoral. Okay? So, if you notice, there are three levels. No? Mo ni siya gina-introduce nato. First, society values and norms. So, is it legal in our society? Let's take for let's talk of women treating men or men treating women in the rehab. Okay, ato na siyang isgutan. Sa society, pwede ba na siya? Yes, sa ato, pwede na siya. But in some cultures, dili siya pwede. In some also belief or in some uh, in some patients, they would say nga, okay na siya, pero I'm not comfortable with it. So, musuludan na siya ang values nila. Groups, diba? In norms, when you say groups, may mga bayi nga dili ganahan nga ang laki mo treat nila. O apoy mga laki nga ganahan sila i-treat sa bayi. So, diba? Dito na siya, no? Conservative group, in non-conservative group. But ang question na to, is it legal? Yes, that is legal. It is not illegal. Kaya nga naman, allowed man na sa law nga ang babae mo treat sa lalaki, ang lalaki mo treat sa babae. Okay. It is moral, still moral. Wala man kay gihimo. Nga immoral dira. Di ba? Unless malisyoso ka din. Pero kung ang bisan malisyoso ka si monhona, pero physically wala kay gihimo nga dautan, it's nothing wrong. No? Individual. So, there, they will come ang imong individual values na. Imong morality as individual. Masulod na siya dayon dira. Hindi ko ganahan, makita na akong kegel. So, digi ka. No? So, inana. So, depende na sa iyo. No? So if you notice, ang center niya is individual dito gyapon. So, we're individually, we will be the one to make decisions for ourselves. We will not rely on other persons. So that's the important aspect of ethics. In the end, ikaw ra man gyapon mahimo sa pag mahimo og choice nimo. Mahimo og choice nimo para unsa may maayo nga i-choose. So, nana siya. Inclusions of ethics. So, sa pag-discuss sa ethics sa students, it is very important the involvement of faculty. No? So, inclusions of ethics in the curriculum requires commitment of faculty. A champion to spearhead the curriculum design, implementation, and evaluation, and subgroup of faculty to assist in this process. So, importante ang role sa faculty in introducing ethics. So, dira makita nato kung ang ethics or ang ethical or ang values, moral values, ethical principle anang as teacher is in question. Dili siya para maayo spearhead siya ana or siya yung tudo ana na ngayon, di ba? Although, butang ta, naaman tingali mga stain, no? Sa iyahang principles, pero ato bang nakita, nga sincere po siya ng change, sincere siya nga ni usab. So, kung makita na to na din, students will also believe them. No? So that's why faculty involvement is very important. And also, establishment of learning objectives. Ethics education must move beyond simply including code of ethics, rules, and legal requirements or knowledge of ethical theories. So, kani siya, dili lang kay makabalon ta dapat sa code of ethics na to dito sa ato ang, di ba, sa WCTT na tay code of ethics sa APTA na po dito, di ba, core values. Di lang kay kato dapat ano yung sana siya mga uh, compassion, unsa na siya mga pagina social responsibility, professional duty, dili lang kay kana is it legal or illegal, dili lang kay kana siya pati knowledge sa mga ethical theories, dili lang, it must go beyond that ang atong pagtulo sa ethics, beyond that area. It should also focus moral judgment, moral sensitivity, reasoning of students in the context of clinical decision making. While this includes necessary rules and norms for practice, requires systematic reflections on one's personal values, beliefs, behaviors, as well as those of its colleagues, clients, profession, society. So that's why cultural competency subject is very important, because in cultural competency, these no mga ethical issues are being presented in this subject, di ba? Naadra makita nato ang personal beliefs sa isa ka culture, kung kana bang atong nahibaw-an nga moral values nga atong nakatunan gikan sa ato is applicable man na didto or dili, kung maka-encounter ta ina ng patients, if we are morally competent or we are, yeah, morally competent and sensitive to this person, we could easily adjust. And we will base our moral decisions based on her, no? Kaya nga naman, again, consumer is always right, di ba? Kidili ato, iya na, sa ato okay man, wa man problema. So dapat musunod siya ato kay siya, kita ang piti, kita ang Ginoo, no. That's an old norm. That is the traditional thinking of unay karaang panghuna sa mga doktor sa una nga sa una gi-consider nila ilang kagalingon nga murag mga Ginoo sila, no? Pero karon dili na. Ang tinuod nga naay power is the patient. Without them, doctors are nothing. Kinsa may imong i-treat kung wala kay pasyente? Unsa may income mo nimo? So patient plays a very important role. So inana siya, no? Saan sa pa na nimo ba ingon nga maadto siya sa ospital, may ingon kang cancer ka, mamatay ka, dapat tambalan ta ka mo ingon siya di ko nakamahimo. Wala. So see, inana siya. Mubayad lang siya sa imong PF pag human na mo pa-treat ko nimo dili ko eh. Higig ka kabuot nga magpa-admit na siya. Bisan sa ako naman nga maghikog man ka tingali, wa gid kay memo kundi na magkuan ang pasyente. So inana, no? Uh, so here, based on this, our clinical decision making and ability to defend the choices we made. So here, once we know all these things as a student and as a professional, we will be able to defend our choices. Anong gipili nato ni because base sa akong pag assess sa patient inani ang ihang kuan, so ako ni siyang gihimo nga choice para niya kay mo ni nahaom para niya, no? Mo ni right nga approach para sa iya. But of course that approach is only good for her, it will not be applicable to everybody. Okay, again, our clinical decision making is tailored to that patient. Not, it is not a generic for everybody. So, maintaining and adapting content. So, as educators, we must be aware of different experiences of our physiotherapists in the clinical setting and ethical issues that were encountered by students and clinicians. So here, as an educator, if you will become an educator, we must be aware of what are the issues that is encountered in the academy for students and as in the clinics. Kung unsay naa sa rehab o unsay naa sa eskwelahan. Unsa may mga issues nga naay ilang encounter per me. Dapat kabalo ko. Muna pud kamo nga estudyante, dapat inyo i-inform inyong teacher pod unsay problema nako sir inani kay sa subject nako nga inani kuha na di mi ka late mi permi sa imo kay tungod ani na pa koy klase dira, no? Di mi i-off dayon. So itug-an ninyo sa inyong teacher, then of course teachers will do something maybe to ask you to ask your teacher to dismiss you early if it will not be it can be not be done by your request, then that's at the time the teacher will go directly to this teacher and also inform her about that, no? Na mo yung sunod anak niya malate mo, kung pwede ba i-dismiss mo not necessarily early but be on time. So inana. So teacher must learn to adapt, no? Para apod ang content sa subject matter niya dili pud obsolete. So kung ano siya nagkakahitabo sa clinics, mao po na yung istorya. So that's why as a teacher dapat kuno kuan siya ang inyong teacher dapat kuno well aware siya sa mga current events na current issues in the clinics, in the rehab, in the hospital, in the school, no? So ana. Now, what are the barriers for students to learn ethics? So students' lack of language and knowledge related to ethics made it difficult for them to appreciate the nature of their discussion and define ethically related learning issues. So mo ni kasagara problema nila, no? Kay I mean terminology wise or language wise wala pa sila kadungog ani or they are not yet knowledgeable and very difficult for them to relate. So that's why it is very important that at first, kung mahimo man gyud mong teacher and later on mahimo man gyud mong professionals, you must learn how to relate with your client uh, on their or you must go to their level. No? Okay? Dili man tanang client ninyo or inyong consumer, consumer is medical professionals or professionals. Some of them will be manindahay, ma some of them are teachers, some of them are teachers not science teacher, nga kanang teacher nga ordinary or kanang general education teacher nga walay background sa inani. So kinahanglan ka mo ah mo go down mo, mag-learn mo how to relate with them. No? So ang imong mga term nga gamiton dili itong mga ikaw na kay akinesis, mga na kay ah, paralysis, naa kay hemiplegia, naa kay paraplegia, quadriplegia. No, don't use that term kung ang imong katubang dili man siya bisan paramedical practitioner pa siya pero butang ta sa man medtech siya or pharmacist siya. So of course these terms are not really emphasized sa ilang pan because their specialization is not on that area. Ba? So dapat kabalo kag kuan ano malo ka nga magkuan og term nimo nga ikuan nimo dito sa insakto nga level nga masabdan niya, no? So inhan na la. So this is in conjunction with competing content and the perception that it is difficult to assess or access appropriate literature may be resulted to students lower prioritization of ethics. So mo gani siya, no? Because before it's very hard to find books, ethics books in allied health. No? Lisod ka ipangita. Lisod. Yeah, solely focuses on ethics. Even ethics in education before is very difficult. So inana siya. So of course, lack of clinical barrier, clinical experience. Kaya nga no, na, di man sila ka-relate. Kaya man sila sa clinic. So, unsa may pag-introduce na ako dira kung wala pa sila sa clinic. Although, we be present a hypothetical case scenario sa atong students. But, aside from that, mas panalitan issues sa professional responsibility or professional duty. How will you discuss that with your students? Dili pa man na sila professional. So, unsaon nimo pag-present nga kana ilang masabtan. Diba? So, ang ginito ni mga issues is between students also because basically they are also professional na in their at their level. So, unsa nga mga issues nga common sa ilang nga involve professional duty, cheating. Kabalo na siya nga nag-cheat ang iyang seatmates. Unsa iyang himuon? Iyang pasagdan or iyang badlongon or iyang kuan. So, masulod na dito dayon ang unsa man? Moral, legal, illegal ug immoral. Okay. Society, is cheating moral? or immoral or legal. So man na, okay, we ano, there are some group who say, kung na siya, oy, normal ra na, di ba? Mm. Ana, di ba? Na yung mga grupo, may normal ra na, or society, na, kinsa mag student, wala ng cheat, oh, so na silang belief. How about sa group? Do you, do you, do you consent on cheating? But in the end, sa sunod, individually, unsa man, ikaw, ganahan ka? Kung dili ka ganahan, unsa may himuon nimo professionally, then you can do two things, no? Ethically, pwede nga ikaw mismo, biblically speaking, na andra dito doon ta unsa ang paghimo og ethic, paghimo og ethical decision making sa Bible. First, kung kabalo ka nga sa ipanghimo unsa man, duolon nimo siya. Dili nimo i-chismis sa bang nga nag-cheating siya, nag-ano, kudigod dili, unsa man, duolon nimo siya. So, as a student, no, I'm just giving you an example para mo na yung dapat example nato para ang barrier ni mo a student barrier is mo break. Kaya dapat ang language yung gamiton is level po sa student. So let's say for example cheating atong gigamit. So unsa man nimo? So ethically sa Bible yun siya nga kung ang kana siya gihimo siya kana unsa man nimo? Duulon nimo siya istoryahon, badlungon. Second, kung di pa gyud siya batuoy, wa ka og isa ka witness. Witness. Duulon nimo siya inyong badlungon. May mayan. Oh, di ba? Kung di siya magpabadlong, that's the time na go to the proper authority. Ato ka sa teacher. But of course, there are some areas nga maulaw mo mag-istorya kay base mo nga self-righteous ra kay ka, no? Para sa imong seatmate, si mo ni mo siyang witness, as self-righteous kay ka, sige lang na usag diri na siya. Then maybe that's the time na mayon ka nga ato na lang nako si sir. Of course, your teacher will also make ethical decision making that uh, regards to that situation. Maybe ang teacher, maybe kay kan wa pa man si proof nga nag-cheat na, maybe i-transfer niya og seat para nga di siya ka-cheat, no? So, although wala pa, pero wala siya kakita, i-prevent na lang to niya to happen again. So, inana siya. So, I hope the discussion this afternoon is about integration of ethics in the curriculum. Is you learn something from it, and I hope you can apply this in your um, you can you will try to learn once you learn this from our class today, you will try to observe it in other classes if really ethics is being introduced there, and you can easily identify it now, and you can say, amo din na siya, naagud di ay no ang ethics itudlo sa kaninga subject, no, in all aspects, in all subject or courses di ay naagud naka-integrate di ay ang ethics, no, sa amo ang BSPT karon, and you will appreciate this subject, and of course you are going to live by it when you graduate and become professional, and you will become an ethical person when you go now to work. Thank you, and may God bless you this afternoon, and at the same time continue to be safe and be happy. Amen.